to share a little bit about our perspectives in terms of how this pandemic has really had an impact on health equity and really shown some of the divides that we have in terms of gender equality and health equity. We could go to the next slide, please. So this is just the background of myself, which we can skip because they've given, I think, a nice introduction in the beginning. Get the next slide. And just a little bit of background about TMC Life Sciences Berhad. So we run Thomson Hospital, Kota Damansara, which is a big tertiary hospital located in a suburb of Petaling Jaya. We also have 6 TMC fertility centers across the nation, and also a retail pharmacy and a Chinese medicine business. So throughout this pandemic, we've seen an impact across patients and customers from different aspects of healthcare, which I will talk about in a bit. Can we go next? Right. So as we know, I think the COVID pandemic has had a disproportionate impact on women. I can speak for myself that in healthcare, in hospitals particularly, more than 70% of healthcare workers are actually women. And so they are really forming the bulk of the frontliners who are risking their lives. Of course, things seem a little bit more settled this time around, but it was truly quite a scary experience for a lot of them in the beginning of the pandemic, sometime early of 2021, when the Delta wave was peaking. These workers were actually had not yet received their vaccinations. They were very worried about bringing the virus home to their husband and children. And the level of anxiety and mental health burden that they faced during that period was not small. We actually had a lot of town hall meetings with the staff where they sort of raised all these issues, and they were terrified actually of actually bringing this somewhat deadly virus back home. And even things like sort of having a COVID allowance and all that did sort of provide some comfort and compensation, but obviously was not enough. The second one I'd like to point out was that I think 60% of women's employment is in the informal economy, with few protections against dismissal and limited access to social protection. And I can say this, that even for women who are gainfully employed, like the nurses who were working in the hospital, there was an incident where we were walking around doing our rounds, and my COO actually saw a huge stash of brownies hidden away in the corner of a staff pantry, and we're wondering where did these brownies come from? And it turns out that there was this nurse supervisor who had to start selling homemade brownies because her husband had lost a job during the pandemic, and she was trying to juggle, her children being the sole breadwinner. And when we spoke to her, she just sort of like broke down. And the enormous pressures that were being faced by them, particularly I think during the first round of lockdowns, where many people had lost their jobs. And because the women who were working in healthcare were seen to have stable employment, they actually shouldered a pretty big burden during that period. And of course, this participation in informal economy, there's very limited access to social protection, and they're all trying to make ends meet. And the third part was actually on the labor force participation rate. I think we see that in Malaysia, it's actually a bit lower than even some of our surrounding neighbors, for example, Singapore and Thailand. And I really think that part of it is really because of the lack of support surrounding shouldering some of the unpaid work that women have to shoulder. So, for example, even with nurses, we had, I think, after the first round of the Delta wave, a lot of resignations that came about because they just they told us that they were responsible for taking care of their parents back home in the kampung, that they had to resign, they had to go back. Somebody had to take care of the elderly parents, and it's almost always the women. And especially if you're a woman trained in healthcare, that burden would definitely preferentially fall onto you. So we did face such an issue, I think, particularly when we saw a lot of elderly population actually being affected by the pandemic, and that burden of that unpaid care work in the family being forced onto women, and therefore they had to drop out of the labor force. And that's not really adding on to the next burden, which is really when schools were closed. That was also a very big deal. At the height of the pandemic worldwide, there were 850 million children who stayed at home. And that burden of actually monitoring the online schooling usually fell to the women. And I personally made it a rule that during our countless video conferencing calls that were happening when people were staying at home or sheltering in place, that women shouldn't have to apologize if the children came up and sort of walked across the screen or sort of interrupted and tried to get their attention during meetings. So I think that part of reality definitely hit a lot of people, because working at home, or working from home rather, is not so straightforward really, and it's taking on a lot of burden, and productivity I think definitely suffers. But we have to be cognizant of the fact that I think that we have to view employees as a person as a whole, and they have many responsibilities at home as well. And so those were some of the things that we were trying to adjust to new ways of working and interacting with our colleagues throughout this pandemic. The next slide, please. Well, this is also some very sad statistics. I think 57% increase in talian kasih calls during MCO. Personally, we also had a few examples as well within the hospital. And I vividly remember working with one shelter. There were a lot of women who were trying to seek shelter very early on in the beginning of the pandemic, but because shelters required PCR tests for new joinees to the shelter, they couldn't afford, at the time when a PCR was about 350 ringgit per swab. We had one woman with 5 children who wanted to seek shelter, but she just couldn't afford the cost of having a PCR. And we actually sent our team over to give her and her children the swab so that they could enter the shelter safely. And I can't imagine that probably so many families at the time who were facing similar issues, and the burden of testing, not just the increase of domestic violence at home, but also the obstructions to being able to access shelter or assistance because of this fear that they may be carrying the virus. In addition, there was definitely reduced access to maternal and reproductive health services as resources were diverted to other areas. Very simply, 2 weeks ago, I was at Hospital Malacca and also the Malacca Convention Center, which has actually been turned into a low-risk quarantine center. And the number of admissions into the low-risk quarantine center continued to be high simply because there were a lot of people who had were not able to isolate at home because they didn't have the necessary facilities like a separate bathroom or a toilet. And to sort of monitor these patients, because you also need a specialist. I was surprised that the specialist in charge of COVID admissions at this low-risk quarantine center was actually an ONG specialist. And what Hospital Malacca was doing is, because Hospital Malacca is the only COVID hospital in the state, they were rotating every 2 weeks specialists from different departments to also oversee the low-risk quarantine center. So for that 2 weeks, the ONG specialist was actually more in charge of COVID and not doing, ONG work. So obviously there was evidence of reduced access, and this story has been replicated, of course, in many other states. I've talked about not having access to social protection, but there it is, 57%. Of female heads of households not having access to social protection. And then the number of suicides, which I think Ren Chung probably can talk more about, but it's really sad to see that the percentage of suicides amongst women were actually very high during this COVID pandemic. Can we go to the next slide? So this, of course, coming from a corporate context as an employer, it comes on top of existing inequalities for women. I'm sure many of you would have heard stories about how women are asked about their marital status during a job interview. They're asked whether they plan to have children, whether they would require a long maternity leave. I do see now actually a movement towards pushing for paternal leave. But, just speaking from the hospital itself, we have, as I said, more than 70% of our healthcare workforce are women. And frankly speaking, operational wise, it's very difficult to provide extended maternity leave when your workforce is overwhelmingly women of childbearing age, because you would run into a situation where 30 to 40% of your workforce would actually be away on maternity leave, and then it becomes difficult to manage. But I think paternal leave is definitely something we should be fighting for. At the hospital, we give 10 days of paternal leave, and I think that the take-up has been very good. We'd like to encourage more men to join healthcare, if there are any men out there interested. Secondly, I think the equal pay for equal value. Now, in healthcare, not many hospitals or healthcare groups have unions, although there is one or two, which was a holdback from previous years. But it's interesting to note that when it comes to unions, it's also predominantly male-led. And sometimes I think this issue of gender equality and, female economic empowerment can sort of fall through the cracks. And yet I note that in the Malaysian Gender Gap Index 2020, women actually surpassed men by far in achieving educational attainment, with the index score of 1.059. So as you know, one means equal, so anything more than that means it's weighted towards women. So obviously, in terms of education, women are getting ahead, but that doesn't seem to be reflected in terms of the employment numbers and also the pay. So next slide. But, I'm hopeful that society is changing. You can go to the next slide. I'm not sure if any of you were keeping in touch with what was happening, but during the most recent International Women's Day, in the UK, companies are required to disclose the gender pay gap data. And as companies in the UK were actually, tweeting out the supportive messages for International Women's Day, there was this couple that created this bot on Twitter that automatically retweeted the company together with the gender pay gap. And obviously it was a very embarrassing moment for some companies, but I thought that was, that's really the ethos of society today, that it's really hard for companies to not be aligned with their messaging, with their practices, because it's very quick, it's very easy, I think, to sort of disclose that disconnect. We have a new level of transparency now with new corporate governance rules, new listing rules. In Malaysia, as a listed company, you would know that the new Malaysian corporate governance guidelines is very much focused on ESG, of which gender equality and health equity is definitely an important pillar. So we'll definitely see more reporting required, I think. And so it's very important for companies to be aligned with what they're communicating out to stakeholders versus what they are actually implementing internally. Next slide. So that really segues into my next point, which is the regulators and investors are watching. So as a member of the Institute of Corporate Directors Malaysia, I know that this is definitely something that is on the radar for many public listed companies, where sustainability reporting is already a key requirement and is probably only going to get more granular. And of course, we see that overall globally, investors are also looking at sustainability as one of the key factors to consider when looking at investability of a company. So therefore, I think it's really important for the board of directors to really keep this in mind. Next slide. Right. Female participation in policy. Unfortunately, it seems political empowerment in Malaysia is very, very low for women compared to even countries like Myanmar and Brunei. But I'm hopeful. I think that the recent elections, if any, would have shown that youth will continue to fight for this in different ways. And I think that it is really time to give and support women to participate in in terms of policy making in politics, because if we don't have that representation there, then it's going to be very difficult for all the other areas to progress. Next slide. So coming back to where I am, what can companies do? And what's on my mind as a CEO? Next slide. Right. Firstly, yes, I think important is representation. Many companies have formed COVID crisis task force and response teams. So question as a CEO you would ask is, are women actually equally represented in these COVID related processes and responses and task forces? Because I think it's important to have that point of view. Secondly, I think it's to encourage female role models. This crisis has really shifted the goalpost in terms of allowing opportunities to open up for more diverse representation from the board level down. I know in the recent budget, the government has mandated that at least one female director on a PLC in Malaysia, which I think is still not enough because, one could not translate to the earlier target of 30%. So I hope we don't lose sight of the 30% goal with this one female director, but I do see the trend in terms of appointment of more female directors on the board level. And speaking as a female director myself, it is really difficult because by and large directorships are still appointed based on a network of who you know. But I think the recent Malaysian corporate governance rules in terms of encouraging PLCs to have a transparent disclosure of director sourcing processes and encouraging third-party agencies to be appointed for sourcing have actually in the past year, you can see the announcements of appointments of directors. We can definitely see more diversity. Thirdly is to partner with government and other sectors. So issues affecting women and health at the workplace don't stop at the company walls. For example, issues of vaccination. Early on, I think we had a lot of hesitancy amongst pregnant women in terms of getting vaccinated, and that unfortunately led to a spike, I think, in maternal deaths due to COVID last year. What are we doing to actually raise the awareness of vaccination and boosters amongst our employees? Access to social protection, do they know where to go? How can we assist them? There've been a raft of incentives and aid that has been announced by the government. Have we done enough to help communicate that down to our employees and provide them the assistance? It's not even the companies coming up with the money, but to navigate, I think the bureaucracy sometimes can be quite overwhelming. And so I think we could do more to actually facilitate access to that social protection. Next slide. Secondly is obviously support. I think in the first column, we all know that, these are normal things that companies would talk about in terms of supporting working parents, flexible work arrangements, safe and appropriate childcare options, paid sick family and emergency leave, equal maternity and paternity leave. These are very concrete and obvious levers that we can have to actually support our employees, knowing that there's a lot of unpaid work and burden that goes into it. So that's definitely something. Secondly is to help address consequences of COVID-related policies. Now, as I have shared earlier, there are issues with domestic violence, with mental health and well-being, pre- and postnatal healthcare, COVID-related coverage. As we know in the beginning, many insurers were not covering COVID tests. They were not covering COVID-related admissions. As a company, how do we step up to help facilitate that, to help make sure that that our employees are safe and protected? Have we done enough to improve ventilation in our commercial buildings, our offices? Because COVID is here to stay, and if we don't adjust to live with it, then it's not going to be very sustainable for our operations moving forward. And last but not least, I think is to support women and communities across the value chain, looking to build relationships with women-owned businesses as part of recovery efforts, expanding our supplier pool, have educational and training policies that support equality, diversity, inclusivity, and well-being. So it's not just about perhaps sensitivity training, but it's also what kind of educational opportunities are open for women in our workforce, what kind of training, what kind of promotions and opportunities are open to them. So that's all part of that capacity building piece that I think that probably we should look into as well. Next. So that's it. Thank you. And I'll pass over back to the moderator.
Thank you, Nadia, for your remarks. Now we'll move on to our panel for the day, and we'll dive deeper into women's health in the workplace beyond the medical. Moderating the panel is Azrul Mohammed Khalib, the Chief Executive of the Gallen Center. Joining him will be our three esteemed panelists, one Nadia, one Muhammad Abdullah Yaqub, Group CEO of TMC Life Sciences and CEO of Thomson Hospital. Ren Chong Yu, Deputy Executive Director and Advocacy Director of Women's Aid Organization, and Tamina Kausji, Communications Consultant, Broadcast Journalist, and Gender Equality Activist. Before I pass this on to the panel, I'd like to remind the audience to join in on the discussion using the conversation chat box that is available on the platform. We will take questions at the end of the discussion. Over to you, Azrul.
Thank you. Assalamualaikum warahmatullahi wabarakatuh, and very good morning to all of you joining us this morning for AmCham's panel discussion on women's health in the workplace beyond the medical. It's AmCham's Women's Week for 2022, and the theme is Reshaping Perspectives. And this panel will be discussing, or at least exploring some ways to raise awareness for women's holistic health at the workplace and looking at establishing a nurturing, productive workforce. And of course, when we talk about holistic health, it goes beyond providing basic healthcare services and explores a total health approach to achieving gender equality in the workplace. What this all means, we'll go into that a little bit later during our session. But I understand just now the moderator did not possibly introduce Ren Chong's daughter over there. So perhaps Ren Chong, maybe you want to introduce your daughter while we start the session. Go ahead, Ren Chong.
Say hi to everyone. Say hello. Yeah, she likes to chime in and observe.
Okay, well, that's good because we obviously need more younger representation these days. It's better to start them young, right, Ren Chong? So this morning we have quite an esteemed panel to discuss these issues, and thanks to the chair for already introducing them to all of us. So I'll go straight into the questions that we have. So if I could ask that our participants for the panel this morning to just send in your questions through the chat function, or to perhaps indicate that you would like to ask questions so that we can pose them to our panelists while we get on with the discussion. So let me go straight to the first question for all of you, and I'll start first with one. Nadia, thank you so much for your presentation earlier, and I was quite intrigued by several points that you raised during the presentation, but I was trying to get to that point concerning holistic health and what does that look like, and you know, what should we be looking out for, and you being the boss of a major hospital in Malaysia would be, I think, best suited compared to all of us here to give your vision as to what it should look like and what you can actually do from your responsibility to actually make that happen. So if you could describe to us what does holistic health mean to you, especially in the context of gender equality for, and in this case for women, and perhaps identify two pillars for us of what would be representing that holistic health. Go ahead, one. You muted, Nadia.
Sorry, newbie mistake. Okay, so for me, I think the important thing is, as I've alluded to, is number one, we need to view employees as a holistic person, right? So our responsibilities as an employer, if we're serious about, having holistic health for our employees, recognize that it doesn't stop at the company's walls, that there are many things outside of that would impact. So, for example, I think, the policies that we make as an employer, as a corporate company, has an effect on their lives outside of work, in terms of, if things like flexible work arrangements, but if you wanted to facilitate that, what is the quality of their internet setup at home? These were all the questions that were being talked about. And really, if we don't address that, then I think the productivity and the mental health and satisfaction of the employees working with us would definitely suffer. And secondly, I think when we look at health, is recognizing that it's not just direct health. It's not just about I provide outpatient benefits, right? It's also about the environment which we ask people to live within. How is the office as an environment? Do people feel that they have empowerment, participation? Is it fun to come to work? I think it's really important for that to keep up that motivation, because frankly, in healthcare, it's been a grueling slog for the last 3 years. It's been really stressful. And I think, like, for example, one of the things that we did that made the doctors really happy was to actually renovate the doctor's lounge, put in a foosball table and gave them good food. And they just felt so much happier to try and come to work and connect with other people. So I think that we need to expand our mind beyond just the direct health benefits to really look at, what does it mean, this environment that we're trying to create for our employees? Is it safe? Have we considered ventilation? What is the quality of interaction? Do people feel like they can access assistance if they need to? So I think these are concrete things that companies can do, and it doesn't just stop at maternal, paternal leave and inpatient, outpatient benefits. That's not just it. It's easier for us in healthcare. Like we had a psychologist, so we had sessions with our staff, and sort of like institutionalize it in the beginning, in the sense that we have, big groups, and we had psychologists share coping mechanisms, but then we encourage people who had their own individual challenges to actually then seek further assistance. So I think that there are things that we can do at a group level to sort of normalize things. And then there are things where we need to encourage people as individuals to be empowered to seek out aid. And I'm not saying that, we did everything right. I have to be frank that in the beginning, when I first became CEO, I was like, we should have extended maternal leave for all our staff, because if we believe that early childhood development is important, then we should be providing that for our staff too. But the reality is, when your workforce in nursing is like 90% women, if everyone goes on maternal leave, the operations just couldn't cope. And so we had to stagger it out based on years of service and things like that. I'm still trying to figure out how we can, make it better, but at least we've extended it for men as well. But I think there are challenges. You have to be brave in terms of making changes. And if things don't work out, you can always sort of like pivot back. But if you're afraid to make the change in the beginning, then nothing's going to change.
Thank you, Nadia, and thank you for opening that whole discussion for us and giving your how shall we say, a bird's eye view of how, as an institution, we could actually look at these issues. And I liked it that you broke it down into both the organization and then the individual level, what we can actually possibly do. And we'll go a little bit into that. But it's important for us to have this vision of what it should look like and work towards that. Tamina, you're one of the persons who, well, at least from my end, see as having been quite visible, moderating quite a number of sessions that talk about some of these issues that we're talking about this morning. And most importantly, looking at issues that affect the individual person, but mostly women. And we have had so many different discussions concerning health, and it seems like women during this COVID-19 period especially are somehow expected to shoulder so many burdens, as mentioned by Nadia earlier, and yet still manage households, go to work when they're husbands lose jobs, they have to find an additional income and so forth. And this can't possibly be healthy. And, with so many discussions that you've taken part in over this past, 2 years or so, how does it look like? What does the landscape look like out there when it comes to women from the individual perspective?
Great question. Thanks so much for that, Azrul. Really love Nadia's presentation earlier as well. And I think when it boils down to the individual versus the organization, as you mentioned, I mean, there have been tons of discussions, particularly I think in the first 6 to 8 months, where literally every MNC, GLC, etc., was jumping on the bandwagon of, the latest buzzword aside from unprecedented, which was mental health, mental health. All those conversations were incredible. Plenty of experts, especially organizational psychologists, etc., were brought in. Their opinions were weighed and valued, but at the same time, I'm not sure how much of that actually translated into frameworks and policies at the workplace, because interlinked to the entire discussion is that when it comes to mental health support, unlike primary health in Malaysia, there's a complete absence of national level infrastructure to address mental health issues. The National Suicide Registry, for one, is still defunct, plus also the police stats that show that suicide rates are now 5 times higher among women compared with men. This all draws back to the wider circle of not just the shadow pandemic of domestic violence, but the fact that by and large in the entire APAC region, women generally perform up to 4 times more domestic and unpaid care labor, right, than men. So this also is an issue because when it comes to us not having any national level infrastructure, communities on the ground, and then women most of all perhaps, we lack the vocabulary, the awareness, the access, and engagement around mental health outside of just a lot of the feel-good messaging that comes out. So at the same time, speaking about women in the media industry, perhaps, which has also been a focus of some of the research that I've done over the past 2 years, what I have discovered by speaking to journalists, be it for research papers or even casual conversation with colleagues, is that increasingly, at least the media industry is just becoming an arena for the childless or child-free woman below a certain age group. The pandemic's pressures, particularly for reporters and those who need to go out, etc., for work, that has become increasingly hard to balance, especially if you've got young children under a certain age. Homeschooling often is not really something which working reporters, working mothers can participate in with the same ease that perhaps working female professionals from other industries can, right? There were a couple of cases that were highlighted early in the pandemic of reporters and of course of nurses and doctors who, they basically had to stay apart from their children for months on end just because the COVID risk was so high at that point in time. What's happened in the media industry, the hidden narrative, particularly when it comes to reporters, not just in the Klang Valley, but let's look at other hubs and centers which are not so urbanized. Looking at Sabah, looking at Sarawak, looking at the East Coast, what's happened is that we've seen a huge drop in the numbers of female journalists, female reporters, because they are simply not able to cope with the pandemic's mental health pressures in addition to all the work responsibilities. That's eventually going to lead to not just a less gender progressive media landscape when it comes to journalism, but also about the issues of financial insecurity for the women in question, and of course how that impacts the family unit itself. So yeah, these are just some of the issues off the top of my head. Back to you, Azrul.
Thanks to you. Thanks so much for mentioning some of those issues, Tamina. And we're going to go into that a little bit more in depth since we have a lot of time this morning. And definitely we are wanting to go into a little bit of how quite a lot of women have been left behind over the past 2 years or so. And it's interesting that you pointed out just now about how the working environment is now favoring the child-free woman, and basically meaning a certain group of people are being disenfranchised and marginalized, even discriminated, I would argue, in the workplace. So we'll go into that a little bit more later, but wanted to get Ren Chung's perspective here in terms of being one of the senior members of the Women's Aid Organization, and being sort of if I dare say, a watchdog on many of these issues that affect women in this country. How do you see the organizations faring in terms of being measured against some of the issues that you work in? And of course we talk about things like sexual harassment, health and workplace, domestic violence, and so forth. But definitely, WAO has been quite vocal on some of these issues over the past year or so at least. So what's your take on it, Rin-Chong?
Thanks, Ashrul. And yeah, a great presentation, Nadia. Really interesting points to me. I think, yeah, I mean, in terms of WAO, I think for us, really, what we want to look at really is, and health is an area, gender and health is certainly an area that we've been looking into more and more in the past 2-3 years, because not only of it's an important area to look into for the well-being of women and gender equality in the country, but also its relation to gender-based violence, which is an issue that WA has always been working on. So for us, really, it's about looking at what are the frameworks and standards as a starting point that all companies, organizations would need to follow. And then secondary to that would be, of course, how people are and how groups are carrying out their part to meet those standards. Areas that I think are important to highlight in terms of when it comes to gender and health. First is relating to issues of and this, I think when most people think about gender and health, the first thing that comes to mind is potentially sexual and reproductive health. And on that aspect, I think in many ways, the country has been doing quite well. But if you look deeper, you'll find a lot of areas where it's quite troubling. So even something like maternity, maternal mortality, it's something that on the face of it, the country seems to be doing quite well. But if you dig deeper and look into sort of the data, you'll see that there are actually quite disturbing regional disparities. Another big issue that has been in terms of sexual reproductive health is, of course, looking at teenage girls and access to health for them. And of course, the thing that we keep seeing again and again is this issue of teenage girls getting pregnant and then negative consequences that follow from them not being able to access basic healthcare and rights. So that is one big issue that it's still something that we need to fix. Another aspect when it comes to gender and health that people who is of interest is, of course, gender-based violence, and more, I think it's an accepted thing that we should look at gender-based violence, domestic violence, sexual assault, things like that. And as a matter of public health, this is something that WHO, for example, has taken on fully as an issue of public health. And in Malaysia, again, in some areas, we're quite innovative. So of course, we have these one-stop crisis centers, which was started in the 90s, which is a very innovative program where theoretically anyone who is a victim or survivor of domestic violence, child abuse, or sexual assault can come to any public hospital, that's the idea, and receive integrated help in one center, be it medical help, social work assistance, making a police report, and so on. So that's great policy, but again, at the implementation stage, we see that how it's implemented is very uneven. Certain hospitals have a very good one-stop crisis center, but studies have been done that show that some one-stop crisis center don't even have basic equipment. So this is an area that we really need to look into. And the other huge gap actually that in terms of gender-based violence and the public healthcare system is our capacities of the Klinik Kesihatan to look into and to respond to gender-based violence. And globally, primary healthcare centers are recognized as one very important avenue to identify cases. So, women may not necessarily go to these, clinic kesihatan to report domestic violence per se, but there may be, other factors that, as a result of domestic violence, they were injured. Or so that's another area where we need to look into. And the third area really is, of course, something that I think globally is something that policymakers are paying more attention to, is that the aspect of general health and how does that affect men and women differently. And good examples are like, okay, if you're patient coming in reporting heart problems, for example, there's a study that showed chest pains, for example, there's a study that showed that doctors tend to take women's complaints less seriously, potentially because of whatever biases that they have. And this is something that I'm not sure is something that we've looked much into in Malaysia, but it's, I think an area that gender and health, I think, is an area that more and more people are getting into. Seeing groups of, certainly for us, it's something that we're exploring more. We're seeing groups like, of course, I was really familiar with OVA, I guess, the new gender and health website that was just set up. So these are just some things that we're looking into, and we think, as a matter of policy, government really needs to pay a bit more attention to.
Thank you, Ren Chung. There's quite a number of areas there that you identified, and I'd like to go into that in a short while. But I would want to get Tamina's take on what the Brookings Institute has described as having disastrous consequences for working women and their families. And this is obviously, I'm talking about COVID-19, and Nadia has mentioned it in her presentation, but I think it can't be underestimated that this pandemic has been a major disruptive force for many in the workplace, and both yourself and Nadia has described some of that effect. And when we're talking about working women and their families, it seems like when we hear about it, it sounds like it's new, but actually it's been around for quite a long time, and the pandemic has only exacerbated that. It's highlighted it. It's underlined it for those who were blind in the past to see, and these are underlying causes that need to be addressed. But as Nadia gave an example of her brownie, story there, which is heartbreaking. When you consider the fact that people have to find ways to make ends meet, and the fact is that many of the problems facing women in the labor market have never been hidden, but they've been inconvenient to address because they're so entrenched in the basic operations of our economy and society. And in the case of Nadia just now, it's about some of the issues linked back to how large the proportion of women represent in her workforce. And then we've got issues such as pay equity, looking at childcare, even things like school routines, affect how women participate in the workforce. So, can I get an idea from you, Tamina? What is, if you were to identify one thing that should change when it comes to women in the workforce today, which has been brought out by COVID-19, what would it be? You muted, Tamina.
Sorry. Okay, there you go. Great question there, Azrul, and really agree with some of the points that Ren brought up. But I think the broader perspective once again goes back to the fact that while particularly in South Asian societies, we've sort of failed with approaching women's rights and women's equity in the workplace from a human rights perspective. I think it's very important, particularly having worked in the beats of business and finance for the past 7-8 years as a journalist, to be framing it from an economic impact. You mentioned actually the Brookings evidence-based numbers, but at the same time, we've got 2019 World Bank reports for Malaysia specific. It was called Breaking Barriers Towards Better Economic Opportunities for Women in Malaysia, whereby in 2019, which means they were looking at stats from 2018 and earlier, Back then, it was predicted that Malaysia-wise income per capita could actually grow by 26.2%, implying, an annual average income gain of about 9,400 ringgit. But this is if all economic barriers are removed for women in Malaysia, and this would result in a cascading impact on everyone's finances. So because we're not really able to frame it from even an economic perspective, but I think that there's never been a better time to do this than now, whereby all economies, especially Malaysia's, which is so very much dependent on trade, FDIs, etc., and also women's LFPR, we need to start framing it from an economic perspective. And removing barriers also includes other movements such as legislating a survivor-centric anti-sexual harassment bill. This also costs us an incredible amount. Malaysia is also one of the fewer countries in the world that still hasn't legislated any of this. And despite what the Malaysian Employers Federation thinks about the fact that it is rare, it is not very common. No, global stats show the prevalence is anywhere between 40 to 80% in workplaces. So all of these are not just conscious but subconscious barriers to women actually actively participating. And this is even outside of industries that naturally, literally had 50%, 70% drops in employment, such as F&B, retail, tourism, which once again are extremely feminized industries. So I think Nadia's example was a great one, and I think it's particularly alarming when you're seeing nurses perhaps, or even doctors who of course are so dedicated and inside the mold of shift work that imagining that did they carve out time to have a home-based cookies business? But you know what? Coming from a media background, I've seen these kind of small businesses being propagated by, of course, the women in the office for years and years. So that once again tells you, the more feminized an industry, the more likely also that wages actually go down rather than go up. So there are systemic, structural, and also, societal issues. But I think first and foremost, we need to frame it from an economic impact and also looking at it through living through COVID as well as post-COVID recovery perspective. If our policymakers can be sensitized to this and not just looking at it as, okay, let's give more aid, let's give 30 million under budget 2022 to build childcare. No, it's not just about that. It's about ensuring that the entire ecosystem is encouraging of not only women who are of childbearing age, but ensuring that women who are in their 50s and their 60s, what about deprivation across the life cycle? We are an aging society, right? So there's so many dimensions to that, but always looking at it from, I feel, economic utility is perhaps the way to go towards, since we've clearly struggled with the human rights perspective for women's equity. Yeah.
Well, that's a real shame. I mean,
I'm just being frank.
I know. No, but I totally understand you there, and I totally agree there. I mean that we have to sort of reduce the human rights angle to harp on and focus on the economic arguments because they are more powerful, and they resonate better with policymakers. I totally agree with you.
And who are policymakers?
Let's get down to that. Hold on. So, Nadia, Tavina mentioned some really great points just now concerning, how we need to look at these things also from the perspective of systemic and institutional structures. Now, I have to say that for Malaysia supposedly being quite a progressive country, when we look at our structures, they're very patriarchal still, and many of the top people, talk about policymakers tend to be men, and as a result, many of the policies, downwards into the workplace areas, it's governed by how it's perceived from the top, and there's been a lot of discussion about whether there's enough bottom-up approaches where some of those issues which are hidden, such as sexual harassment, for example, are not taken seriously because the top guys are men, can actually change if there were changes on the top. And you're in a position to make some of those changes that for many of us it's aspirational or theoretical. And you being the head of your organization, if you had a choice today and there being a long laundry list of changes that need to be made and gaps that need to be overcome and so forth. If you wanted to choose one thing that you could change in your organization, what would it be to address the issue of gender equity and some of the issues that we mentioned just now? Go ahead, Nadia.
Well, actually, frankly, I think that a lot of the issues that we're facing now, particularly I think with COVID, is that there's a lot of intersections that are being created. And because Malaysia, I think in terms of policy makers and also agencies, is very bureaucratic, we have this silo problem. And just one really simple example. During COVID, we had a lot of parents who were hospitalized, right? Father and mother both in ICU, children, who takes care of them? And, Jabatan Kebajikan will say, it's COVID, it's not my problem, it's MOH's problem. MOH will say, I don't have the capacity to take care of children who may or may not be COVID positive. We had instances where husbands said they just couldn't handle because the wife was admitted to the ICU. Somebody please take the kids because I can't manage them. And so there's a lot of intersections, I think, between different agencies. And this problem is also replicated within organizations. Is it HR issue? Is it, if we're talking about clinical governance, is it the medical director's issue to, reprimand doctors who may have had sexual harassment allegations amongst them? This issue about accountability and, actually coming together to solve the problem rather than just trying to determine who's responsible for what is actually a big stumbling block to getting things done. I don't have a solution. Of course, I think what was helpful during COVID is that it creates a sense of urgency. There's the scale of the problem, public health, and therefore there were task forces that were set up, be it in a company or a national level, that just had the absolute authority to override current power structures to make the decisions that needed to be made. But how sustainable is this in the long run, right? So I think that there's a lot of these issues, and it seems really stupid now looking back at it, but I mean, that was the reality on the ground that was being faced, that, we were fighting to have, somebody try and take care of these kids. There were NGOs who wanted to help, but the law was not written in a way that would allow them to take over these children because there were no guardians that were giving, and you can't take consent from somebody who's intubated. So a whole host of issues, but it really boils down to this lack of accountability and this silo mentality, and that happens whether it is in a company or whether it is in a country.
Would you say that some of that disruption that you just mentioned just now would possibly initiate reforms within structures like, the welfare system or, social services, or are they just going to revert back to what it was after the initial kuchar kacir and then it just goes back to the same thing? I mean, what do you think?
You need champions to make sure that the reforms actually stick. My fear is that once the sense of urgency has passed, things will naturally fall back to where they were. And we really need to segregate between what are short-term immediate problems like COVID and what are long-term systemic issues. I mean, you're talking about things like, we're mentioning policy, access to care. I mean, in Malaysia, Muslim women aren't allowed to do egg freezing, for example. They just came back from the Middle East. And they're looking at us saying, like, why are you so backward? And I don't have an answer for them. But it's really that there's politicization, unfortunately, and religious sentiment that is coming into women's health and health in general. I don't think that this is a healthy trend. Malaysia would not have been successful in managing the HIV pandemic without having a very science-based approach to harm reduction. And if we don't have that similar approach to other issues that may involve, sexual reproductive health or other things, then it's going to be very difficult for us moving forward in the healthcare industry. For example, within the fertility, there's also already now a new Reproductive Medicine Act that will come into place that would ban gamete donations. And so these are some of the things that I think, you're talking about women participating in the workforce, and increasingly it's very difficult for them without having options of how to manage fertility, about how to manage family. During the first lockdown, a lot of nurses were suffering because reality is they send their kids back to the kampong for the parents to take care of. That is the cheapest form of healthcare. And when you have movement control between states, that was it. They just wiped that out. And so they either quit or, you know, they just had to find some way to cope, and most of them could not cope, in fact. So these are a lot of like systemic issues around what support is there for women and families, children in particular, because I think if you address the children, that's like, you know, at least 30% of the burden that women have to shoulder. So I don't have any quick answers, but just an observation of what we've lived through the past 2-3 years.
Thank you for pointing that out, Nadia. You know, one of the more bizarre stories that came out during the MCO, the lockdown in 2020, was these media reports of husbands, men wandering the supermarket aisles looking for stuff that usually their wives would actually go out looking for. Didn't know what sawi looks like, or daun kuchai, or any of these things. And I came out in international media, you know, and it is just a small fraction of how much of a disruption it could be, that, you know, because gender roles are so ingrained that, you know, even men don't even understand what things look like. And I'm sure Renchung might have had that experience himself. But I want to come to you, Renchung, on a particularly vexing issue. And Timina may have some opinion about this herself, but recently in the Johor elections, you know, leading up to it, and of course the night of the election results, you know, we saw Astro Awani putting out, you know, panels of analysts discussing the minute by minute, hour to hour, you know, in terms of the results that were coming out, but discussions what was happening, and they were all men, Renchung, all men, you know. So it was a continuous panel of men. It was a Manola basically, and you know, there is this impression, and it's reinforced by very visible examples, not just in the media, but also in terms of leadership and so forth, that when it comes to soft issues like health, social welfare, family, these are all soft issues that you hand it over to the women. But when it comes to politics, foreign policy, hard hit defense, you know, hard issues, supposedly, this is for the men, you know. And, you know, in the workplace, we see this also being instituted, with gender roles also come into play, where women are thought to be suitable for certain roles and responsibilities and not for others. So you're being part of WAO, seeing this. I mean, obviously you've made comments in the past concerning some of these ingrained perceptions. How can we go about changing this? Because it's core to looking at advancement of women in the workplace, but also talking about gender equity. You know, we basically be able to ensure that everybody has an equal chance at being able to do what they do best, and not based on some plumbing issue. Go ahead, Renchung.
Thanks, Azrul. I mean, you know, this is a really key point. And as you touched on, it's something that affects all sectors, pretty much all sectors, all spheres of life in the country. And as you touched on earlier also, you know, these things are important because they lead to different outcomes, right? If you have, you know, a bunch of men making certain decisions on policies or other matters, then the outcome of that discussion, the decisions made, are of course going to be skewed towards more what, you know, what they are familiar with and what they want. And that means, you know, the needs of people who are excluded, in this case women, are you know, not taken into account. So this is a really, you know, key point that we need to solve. And you know, we're not doing well at all in terms of representation. We mentioned, you mentioned politics, and in most assemblies in the country, you know, if you look at highest level of representation, you know, parliament, state assemblies, cabinet, it's not even 20%. There are some state assemblies with zero EXCO members who are women is pretty dismal. If you look at even senior management, things like that, board directorships, few indicators are above 30%. It's quite sad. And one sector where there has been fairly good progress is the judiciary. With the majority, in federal court. But by and far, representation is an issue where Malaysia actually does really poorly. The other sector that this is the case is, of course, in the workplace.
Put the kettle in the kettle.
So in the workplace, we know Malaysia's labor force participation is very low for women. It's below 60%. Whereas for men, it's been above 80% consistently. And so we know that COVID has actually kind of worsened these gaps, whereby more women dropped out of the labor force. Men also dropped out of the labor force. More women dropped out of the labor force as a result of COVID. And that's just labor force participation. We still have issues of wage gap, glass ceiling, and so on. So how do we deal with this? There's so many things that we need to do. One is just, I think, to your example of the manuals, people just have to stop doing that. There are some things that people just have to stop doing. Just don't do manuals. Sure, there may be some cases where just by chance you could say, oh, just by chance it happened to be a manual, but that's not a good enough excuse anymore. When we given the situation we are in, where bias and has created a situation where manuals are the norm, we have to actively fight against these things. So when it comes to panels, we just have to stop organizing manuals. I think that's the key thing. And then the broader issue, of course, when we talk about women's representation in certain areas, there are different kinds of solutions that we need to take. So, for example, Nadia was mentioning the matter of women in boards. And experience shows that quotas don't really work. And what works are targets. You have to. What works are hard quotas. Targets don't work. Quotas
work.
Quotas work. So if you have these targets that are sort of just aspirational, we don't really get there at all. But once you start implementing hard quotas, people have no choice. So they have to follow. And over time, quotas will change norms. Quotas will build capacity. Quotas will increase representation and reduce biases, because people have that role model. Have that. Okay. Yeah. So quotas do work. And so in some areas, I think Malaysians have a sort of a aversion to quotas for maybe good reasons. But in some cases, quotas work. Minimum gender or based on other criteria. So that's number one. Just one more example. When it comes to the workplace, what is the main thing that's keeping women out of the workforce? It's very simple. It's household and family responsibilities. This is very clear. Khazanah Research Institute has done an analysis of DOSM data, and it shows that 2.5, almost 2.6, this is maybe 2018 or so, 2.6 million women are out of the workforce. Means they're not even actively looking for formal work because of family and household responsibilities. And how many men do you think are out of the workforce for the same reason? Only 70,000. So the order of magnitude difference is huge. Sure, some people have different choices and preferences, but the point is we want to make sure that the ecosystem is such that people can make choices that they want to. So if we want to address this issue of disparity in terms of representation, in this case, labor force participation of women in the economy, we have to look at issues of household and family responsibilities, and childcare is the main thing. Childcare. How do we improve childcare? Some countries have free childcare for children of certain ages. What we're doing is not enough. I think the government they know that childcare is an issue. Okay. But the level of investment, we need a step change in policy. We can't incrementally. One analysis by I can't remember the exact name of it, but it's basically an association of childcare services in Malaysia. They estimate that there are about maybe 4,000 or 5,000 centers, and the number that they say we need is 80,000. So, you know, the government analysis, they said we need 40,000. So, you know, 10 or 20-fold gap. And so it's these incremental changes of like 30 million here, 30 million there, or you know, tax relief, which, you know, some people don't, in this is applicable to only certain level of people, certain, you know, sectors of society. These things are not enough. We need a huge, ambitious step change policy when it comes to childcare.
Okay, I actually have two questions, one each for Nadia and Tamina, responding to what Ren Chung mentioned just now. The first one goes to Tamina here. Representation, you know, and the media is responsible for quite a bit of it, you know, what we see. And not to put you on the spot, well, of course I am, but, you know, sometimes people say having the moderator there being a woman is enough to not be a manel. And I totally disagree with that, but that's just me. But, you know, the formation of these discussions, these panels, these decision policy maker type, you know, highbrow, high level groupings, it matters who's on the panel there. And unfortunately, the media has helped shape some of that because of its visibility and reach. So first of all, have you seen enough of this? And, you know, what can you do perhaps to try to change some of that, if you could?
Right. Fantastic. Love the question. Love all the points that Ren made, actually, Azrul. And I really want to talk about the broader superstructure, which is an absolute lack of newsroom editorial diversity. So in general, you're going to be having Malay Muslim men who are in their 50s or older, who are in the senior leadership roles in newsrooms. This directly impacts what the output of each and every news media organization is. If you want to compare it versus, you know, state broadcasters, private media, or independent media, or even online media, generally you will see that gender issues are better represented in independent online, because also they not only have younger teams, but they have more ethnically as well as socially diverse leadership. So that's issue number one. As a journalist myself, one who works in the broadcast medium, that is my pet peeve. Assuming that if the moderator of a certain, let's say, talk show, etc., is female, that's okay. That's your gender quota. Most definitely not. You still need to have a gender diverse panel, and also one that is diverse when it comes to backgrounds. But let me talk a little bit about why it is particularly in political and hard news coverage, the gender bias and the amount and type of media that coverage that politicians receive is usually skewed towards the male. So present day politics strongly mediatized. Voters also rely almost exclusively on the media for political information, right? But at the same time, disadvantageous reporting by the media is often skewed in the favor of male candidates. Number one, because you do not have the sensitization, diversity, and awareness training in newsrooms. So that translates to not only putting on most likely a male moderator, because it's not often seen as female anchors are qualified enough, quote unquote, even if you work the political beat 24/7, 365 as being the anchor for this particular specials, right? So basically, this also starts with gendered access to networks. So this could be a mechanism that actually drives gender differences in news visibility. Political journalism in Malaysia globally is also a majority male profession. Journalists maintain very fixed contact lists as well as socialize generally informally with politicians during outside office hours if you're working the political beat. So if journalists have a preference for same gender informal contacts, this could lead the male majority of journalists to reach out much more easily to male politicians as sources for an article, like a guest on a talk show. So this results in male politicians being more visible in the news. That plays in with our general stereotypes about male possessing these agenetic qualities, such as being aggressive, dominant, ambitious, independent, decisive. You know, it's a whole laundry list. But if any of these were to apply to a female politician, see how immediately the perspective would be skewed. So those are our unconscious biases, right? But at the same time, let's not also forget that when it really boils down to it, it's in the headlines, it's in the stereotypes. With regards to the Johor elections, I'll never forget, it was actually a female journalist from one of the publications that had written a report on brainy beauties, describing Johor female candidates.
True.
I was like,
oh my God.
Cringe aside, have we ever seen male political candidates pitched as, hunky, politicians? So it's just that, it's worsened, definitely. It's entrenched by media, but we are seeing a lot more progressive journalism, particularly in the digital space, whereby the editorial and the reporting teams themselves are more gender diverse, younger, more women, definitely, and that's also reflected in the programming. So things are getting better, definitely not in mainstream state broadcasters, but perhaps more in the more open digital spaces.
Well, hopefully some of the leadership of those broadcasters are listening to this, and perhaps they'll think a little bit more about how they do their editorial composition, right? And Nadia, some of the things that Renchong mentioned just now, if you're a leader of MNC or perhaps a major or even a small Malaysian company, would be terrified of thinking of hiring women. He's talking about millions of women who exit or are not wanting to enter the workforce because of household or family commitments. And today, even though it's not ethical to ask a candidate for a job, when are you going to get pregnant? Are you planning to get pregnant soon? Are you getting married soon? And so forth. These questions still get asked. And it does give the impression that women, though, form a major component of the Malaysian workforce and a very vital and important one, is still considered a little bit of a liability because of what I would consider actually her strengths, arguably, in terms of that. But it's being viewed by certain quarters, especially being so vulnerable after the COVID-19 lockdowns and restrictions and so forth. Now they're looking at prioritizing who they should be hiring, and they're wanting to look at people, and they will be looking at what was described just now as child-free women. So how can we change this? I mean, how do you allow for HR to ask these sort of questions in your organization?
No, but I have come across, and I think that's why leadership, I think, is the most important one, because they set the tone of the expectation of the kind of behaviors that are acceptable, or the kind of behaviors that we want to exhibit across the organization. And so therefore, I think that with companies, change has to start from the top as well. And people just need to be made aware. I've had instances in board meetings where directors will say like, oh, I didn't know you knew so much about ceramic air chillers. And I was like, that's sexist. Don't say that. I've had HR come back to me, and they're also women. They're like, do you really want to hire this candidate because she's 4 months pregnant? You're like, so what? Pregnancy is part of life, right? So I think that moral and leadership, and that ethical and moral leadership needs to be there if you want to set the tone of behavior. And I also think that this COVID pandemic has shown a lot of cracks. For example, I think that a lot of women or a lot of children were taken out of childcare because of COVID, and that actually increased the burden for women to take care of these children at home, right? Because parents were afraid to send the kids to childcare centers because the COVID pandemic is spreading. It's even happening now, and school, whether they like it or not, schools closing down, close contacts, and things like that. But on the other hand, we also, because there is a need for more resources, we see MOH calling back retired nurses, people actually actively trying to bring back women who have dropped out of the workforce back in, and having programs as to how to actually bring back women into the workforce. And these kind of efforts also need to continue. I think in the vaccination centers, by and large, you'll see that there are a lot of actually retired nurses who have come back to actually provide the vaccination. So it has opened up opportunities, and I think that is also really important. So we need to look at both sides, right? We don't want them to drop out, but we also recognize that women as a whole are, if they make a choice to stay at home and take care of their children, that's good. They should be supported, and we should offer them a way back into the workforce, because otherwise we're all going to lose out. We know that in healthcare, the workforce is a severe constraint. We are losing our nurses and doctors to countries like Singapore and Saudi. Malaysian nurses are universally accepted worldwide. And so, we have to be creative in terms of thinking of how to actually recruit and retain, and also bring back once they have, so we even have programs where we have a sister hospital in Singapore. And reality is that, look, Singapore's pay is a lot higher. They give them free accommodation, free meal on board. Fine, well and good, go do your time in Singapore, make enough money so you can pay off your personal loans, come back and we'll recognize your tenure. I mean, companies just have to be a little bit more open. And once the borders reopen in April, this movement of resources is going to be even more fluid. And if we don't adapt, we've had all this time with our borders closed and all that. I hope that people have taken that time well to actually plan for what is to come, because there are a lot of people who have severe financial burdens. When the borders open, there are a lot of people who are going to be seeking economic opportunities elsewhere. And are we ready as a company? Have we made enough plans to prepare ourselves for what is going to happen? And if we don't change, the world is changing around us, and you're just going to get swept away.
Nadia, that just delves in very nicely with the International Women's Day theme this year, which is break the bias, and needing to adapt and means breaking down some of those biases that we've had. And right now we've got to prepare for that possible exodus, even, heading southwards to Singapore, because realities exist. People need to be able to care for their families and to address some of those financial gaps that have widened as a result of the past couple of years. And these are things that, well, Malaysian employers, if they're not going to adapt and change their behavior, they can be left behind, because valuable resources are going elsewhere. And we can't afford to be, continuing with very patriarchal structures. We don't recognize the value of individuals. And this is something that we need to change. So, we mentioned quite a bit of issues here within the workplace. And I really wanted to now go into a little bit of hard-hitting, well, not that it isn't hard-hitting already, but some of these issues that we're ongoing topic that has been discussed about, which is sexual harassment. And this is something that we can't shy away from. And the anecdotal data seems to indicate that the levels of tolerance for sexual harassment have reduced. There's more incidents of sexual harassment as a result of COVID-19. There's more, how should we say, they can't do anything much about it because they need the job. Therefore, they're not going to put in complaints. And survivors of sexual harassment have basically been unable to do much of anything, especially after the COVID-19 lockdowns restrictions, which have made them more vulnerable. So let me ask Nadia this, and in terms of your organization, how is sexual harassment managed? Is there a framework? Are there existing disciplinary structures that are able to respond? And most importantly, I think, considering the Me Too movement's phrase, which is at the very beginning, is that you're heard and you're understood. So are people coming forward within your organizations being heard, and are they understood?
I think, of course, it's very important to have mechanisms and be very firm that every complaint is treated seriously, because I think there is a tendency when there is a difference in power structure level that some complaints can be pushed aside. Now, uniquely in healthcare, there are different kinds of complaints. We have complaints where patients are sexually harassed or abused by medical staff. And this can happen. And of course, you have policies where you're supposed to have proper chaperones and things like that. But it also creates this perverse a preference where we would prefer actually to hire female medical officers because you're less likely to run into issues where you need a chaperone, which brings me to the second part, which is if you have a female staff attending to a male patient on her own, you don't need a chaperone. But if I have a male staff attending a female patient, I need a chaperone. So, and so it creates this kind of like perverse thing where you're like, oh, I just need more female staff because otherwise I just have to hire like multiple chaperones just to follow this guy around. So that's that. And then there's also things that happen between staff, right? So doctors and nurses or within the management staff. So obviously we have mechanisms to deal with them and also very cognizant of the fact that I think there are issues that we can deal with in terms of disciplinary issues, but there are also issues where companies should not be afraid to report such wrongdoings to external authorities. I think sometimes the people in healthcare, you can report to the medical council, you can report to the police, and sometimes people are afraid that they would get dragged in because they see this as an individual problem. We have a company policy, they're not supposed to do this. If it does happen, okay, I might sack the other person or, take disciplinary action, but that's where my responsibility ends. And I don't think that should be the case. I know there's been a case involving a psychiatrist at Thomson Hospital that, hit the news. And I think we were very firm about, taking action, and we leave actually the courts to decide who was in the wrong. But I think that companies should also take up that responsibility, because if you don't make that report and you just quietly terminate the person, this person can also repeat the same thing again in another organization. So where does the chain stop? You got to break the chain as well. So so a lot of different issues may be perhaps unique to healthcare, where we have this kind of like gender roles even within the profession. And how that creates a safe or not safe work environment for employees. The other thing is also, I think, violence against healthcare workers has actually increased. There's been a lot of frustration, and healthcare workers also feel helpless, right? There are no beds. Why can't I see my COVID positive family member before they pass? And so we've also had to manage such issues where violence is being perpetrated against healthcare workers as well.
Thanks, Nadia, for pointing that out. That has been a very, I wouldn't say emerging, but it's been always there in the background. And because of COVID-19, it's just erupted and towards healthcare professionals, especially in the public health sector. And I think the Ministry of Health actually put out a campaign on that, against violence towards healthcare professionals. And
we have people calling in and saying like, you are, how do I say this, agent Dajjal for giving vaccinations and really like mentally, very berating the staff on the phone. And it can be quite taxing and scary for them.
I hope that there are support systems for cases like that, because verbal abuse is quite taxing as well. It does extract a toll on mental health.
Yeah.
And
I think that's also an important point. You may have like reporting or mechanisms to address grievances, which I think is well and good. It's important to have those. But at the end of the day to day, I think the managers and the supervisors providing support is extremely important, because the trigger point to cross that threshold for people to make an independent report varies depending on the person. But at the very least, I think the managers or the supervisors should be trained to give that kind of support on a day-to-day basis. Because a lot of times I find that it doesn't, they find that it's too petty to try and make a proper report on. But if you get faced with small things daily, they kind of add up in the end. So there must be some sort of other mechanisms, like, for example, like staff town halls, roundtable discussions where we just tell them like, look, just tell us what's happening, so that we can have also a different way of flagging up issues rather than just an official channel.
Okay. Thank you, Nadia. And I think some of the listeners out there, please do send in your questions if you have any. for our panelists here, and please don't be shy in just using that chat function there. Some of the points that you've raised, Nadia, I do hope some of the listeners out there will take heed and to be able to see about emulating in their individual structures if they don't already have them. Tamina, when the Me Too movement broke out around a decade ago in the US, and then we started to see ripple effects across the world. We saw it in India and quite a number of European countries in the UK and so forth. But in Malaysia, it was crickets, at least from what I could see, and it didn't seem like we had one particular moment or particular situation in which sexual harassment was being taken up and amplified in the way that we saw in some other countries, and it's been arguably business as usual. I don't know if you agree with me on this, Tamina, but is this your impression? And do you think that when it comes to support for people who are facing sexual harassment, it hasn't changed much?
Yeah, I'll definitely agree that it is business as usual. But however, at the same time, business has been impacted. It's just that leadership is unwilling to face up to the reality that when women speak up, or even men who have been sexually harassed at work, making it a not safe workplace, it not only impacts employee productivity, etc., but also organizational and industry-based trust perceptions. This is particularly true of media. I think, of course, we all know about the media organization, which had an immense opportunity that they did not take in December 2018 to actually address systemic and present workplace sexual harassment and even purportedly assault. But that actually points to the broader organizational structure, just putting their heads down, shoving everything under the carpet and saying, hey, it's fine. But you know what? Said media organization never quite recovered their numbers, their ratings, their trust perceptions from the public for months. Their social media was besieged by comments whereby listeners or just casual commenters would bring up repeatedly the incident. So I think it really shows.
That's true. Yeah.
It really shows that, sensitization is growing amongst Malaysians in general, not just amongst women, amongst men as well. And just like many other social issues which are still not covered in mainstream media, there's no agenda setting. They're only reported when incidents show up. The conversation often starts on social media, on Twitter, TikTok. We've seen it with, the period spot checks. We've seen it with the rape culture, jokes and sexual harassment in schools, on TV shows, etc. But it becomes such an uncontrollable, conflagration of opinions, etc., that eventually it often points to one certain institution or one certain industry or sector whereby it's rampant, and then it has to be discussed. But again, everything freezes at the policy level, and it's assumed that, the news cycle will eventually be overtaken by some other issue. But the fact of the matter is these issues are not going to go away, particularly when it comes to workplace sexual harassment, because people are demanding, and particularly as our workforce also gets younger, they want to know that I am safe when I go into work. I don't have to worry about whether or not how I'm going to inevitably report some form of sexual harassment that actually occurs. And I have heard these concerns voiced by individuals of all backgrounds, all genders. It is no longer a women's only issue. I think it has to do with organizational credibility too. Yeah, a zero tolerance policy first and foremost, and ensuring it's not just HR that pushes this out. That's most critical. But when it comes to, for example, what Nadia recommended, like town halls, etc., I think that's brilliant, though it only works within organizations that already have that close employee-to-employer relationship. In organizations where the power differential is just so vast, it is even more difficult within a smaller closed group context for employees to speak up. Yeah.
Thank you, Tamina. Those are really fantastic interventions there. Really good for us to take up. And I was writing furiously just now some of the points there. And certainly the power differentiation is something that we also have to be cognizant of. Seeing how in Malaysia, the power gap is such a huge, I think it's one of the highest in the world, when I was taken from the policymaker to the individual. speaking of policies, Ren Chong, we know that the sexual harassment bill is supposed to be tabled in Parliament. I'm saying supposedly because we don't know yet whether this thing's going to actually happen. But you, as WAO and a coalition of other organizations that work on women's issues, have expressed reservations and concerns about the supposed inadequacies of this current version of the sexual harassment bill. Could you talk to us a little bit about some of those shortcomings and also how it could be made better, especially within the context of organizations? Because at the end of the day, right, Ren Chong, you don't need to have a law in place to make those changes possible at the organizational level, right? I mean, laws are good, laws are necessary for the framework, but organizations can go ahead and implement them anyway in the absence of the law. So what does a law provide, in support of that? Go ahead, Ren Chong.
First of all, so I think the first thing to say is that we need something. We need something to address sexual harassment, simply because there's no way to deny that sexual harassment is a huge issue in the country. One thing we've seen over the past 2 years, as a result of the Me Too, sort of the Malaysian Me Too, and I really point to the Sungai Buloh case actually as sort of one of the maybe milestone Me Too moments in Malaysia, as well as the sort of media organization case that Tamina mentioned. YouGov has done a survey. WAO is another firm, Vast.ai, did a survey recently. Ipsos did a survey earlier, late last year. Cent GPS did a sort of survey. So these are all sort of surveys that try to be as representative as possible, 1,000 sample size and so on, and all have found high levels of sexual harassment, above 30%. And the Ipsos survey recently found that it's actually the top issue that women are concerned about. That's definitely for sure. In terms of the law, to answer your question as well, I think what the law really does is that it ensures that the same standards applied to everyone. We may have, and we don't, as opposed to someone being beholden or reliant to working in a particular company or being in any setting, a student at college, anyone taking a public transportation. So you may have companies that are good, and they have a policy and they implement it well. But you may have other companies that totally disregard sexual harassment and will not even accept a complaint. You might be going to you might be a student at a university that has sexual harassment committee and clear mechanisms, but you also might be a student at college that doesn't have that. So what a law can do, and why we need strong policy framework, is to create this minimum standard that is acceptable and everyone needs to abide by. So looking at the current bill, what's going on there? The sexual harassment bill is something that I think has the potential to be one concrete outcome of the whole Me Too movement in the Malaysian context. Really is something that, just sort of a side point, but in terms of policy reforms that I've been involved in, this is really, I think, the example of, you cannot pinpoint to any, it's so organic and so, everyone is just pushing for something. And it's just pretty incredible to see that, it's so obvious. People want this, people want something, some solution. And so we need to make sure that this bill gives some adequate response. We cannot let a bill that is just okay to come to be. That would be a total letdown to every single survivor who's ever, shared their story and tried to get protection and justice for themselves. And so we feel the current bill doesn't meet that standard of something that is, minimally acceptable.
Okay.
It's not, bad in the sense that it's not like, putting it into anything that's negative, but it's sort of inadequate. So why do we say this? What the bill does is, the main thing the bill does really is create, number one, a definition of sexual harassment, and number two, it creates a tribunal, so a mechanism for people to report cases. So in effect, it sort of makes the tort of sexual harassment, which is sort of, currently in under Malaysian case law, you can sue somebody else for sexual harassment. So of course that is, difficult because taking up a court case is quite expensive. In the thousands, maybe tens of thousands even ringgit. It's a very public process. It's a very drawn out process. So while it's good that we have the tort of sexual harassment, it's not a acceptable and accessible avenue for most people.
Okay.
So in effect, what this bill does in its current form is it creates a tribunal that would enable anyone to make a report directly to a tribunal. So of course, in a tribunal setting, it's not, it's more limited than a court, but it's also more accessible. It's free or very cheap. It would you would not need to hire a lawyer. The setting would be more confidential, and you would get some assistance from the tribunal itself. So in that sense, that is something positive that is included in the current bill. The problem with it that we see is that it is very what's the problem with having a tribunal is that you are really leaving it to the individual who feels that they are in a situation where it's so too much already that they need to go and take the effort and make a report to the tribunal. It does not have any preventative steps, for example. So what we want to see is that some kind of standard that would apply generally to any organization, and especially looking at where the sexual harassment occur. We know it's not just one-to-one. We know sexual harassment occurs. Most of the sexual harassment cases occur either in the workplace, in colleges or universities or other educational institutions, in public transport, or in public spaces, malls, for example.
Okay.
So we need to, if you want to address sexual harassment in a way that is meaningful, we need to ensure that these spaces are safe, so that number one, the harassment does not occur as much as possible, prevention, and number two, people who experience sexual harassment have an easy avenue to make their case and to sort of improve the safety of the space for others. So just an example, say you're a college student and maybe a lecturer is sending you inappropriate messages late at night, there are sexual connotations. So if you were that student, first of all, if you had organizational responsibilities, hopefully it would spell out that these things are not acceptable and that incident would not have occurred in the first place. But secondly, if such an incident were to have occurred, what do you think is the easiest avenue for that person? Probably it'll be something like, hey, I'm going to inform student services, or I'm going to inform my other lecturer, and they're going to help me solve the issue internally.
Okay. Versus
saying I have to make take a case to the tribunal. That is, while that's a good avenue to have, it's already taking it to the sort of the next level. So if you do not have blanket rules, basic minimum rules for any organization to put in place, we're creating this. We're not going to capture a large number of cases that hurt, number one, and number two, we're not going to create preventative measures to actually stop cases from happening in the first place. So what groups want to see is, let's put that in. There was a special projects team that the Ministry of Women.
Very quickly, Rencho.
Sorry, yeah. That put all these elements into the bill. So we want to see that, but somehow it was taken out before the bill was tabled. So we want put back organizational responsibilities. That's really the main aspect that we think is important.
Okay. Thank you, Rencho. Thank you, everyone. We're actually coming to the end of this morning's session, and however, before that, I would want to give 30 seconds each to our panelists to give a little bit of their message or parting words concerning the issue, but also perhaps a little bit of what they would like to see change. And I give it first to Nadia. Go ahead, 30 seconds.
So I hope that people will use the lessons from this crisis to make meaningful and long-lasting changes to the way we are doing things, because I think that this is an opportunity that we should not waste. Yeah, so that's my take on it.
Thanks, Nadia. Rencho.
I think for me, it's number one is we're talking specifically about mental health and about specific issues, but it's coming from the perspective of course, an NGO, but also someone who has a role in managing an organization. We cannot forget that really the fundamentals are important, as important or more important than talking about these specific issues. If we don't solve issues like workload, burnout, culture, job security, wages, things like that, that is going to have a huge toll on mental health and well-being as well. So I think, for me, that's been one lesson, is to ensure that, we need, that's really, I think when come back to the theme of holistic health, we need to include those fundamentals as well.
Thank you, Ren Chung. And the final word, Tamina. Go ahead.
Thanks for that, Azrul. I think I would just like to, for my final words, focus on stigma. Stigma persists at workplaces, and speaking up about requiring mental health assistance and even paid leave. I want to highlight that I have come across so many incidences of mutuals afraid to put down their mental health needs and even pay for therapy out of pocket, so it's not noted on their insurance records. Malaysian employers have been known to weaponize such personal health information during job interviews, even during employee reviews, to discriminate against potential and existing employees. As long as mental health is viewed as a burden, a financial economic burden that employers and organizations do not want to take on, there is no point to just, discussing mental health and using, the buzzwords, but companies at the same time are not proactively ensuring employees' holistic well-being. So yes, it's about, getting past the stigma first from an organizational perspective, and then perhaps we can rely on people actually speaking their truths about how they need to be supported with access to mental health care services. That, I feel, is the biggest existing gap in Malaysian workplaces. Thank you.
Thank you so much, Tamina. Thank you, Nadia, and thank you, Ren Chung, for being such fantastic panelists.